Streaming live. I'm going to start in a while. Yeah. So welcome everybody. Welcome to another lovely webinar with Haroula and Beth. Beth, Beth and Haroula have been with us for I think the last 3 months, and this is their fourth webinar they're doing with us. The last time we had a webinar with dealing with the women conditions which basically focused on the women. This time again we have another one with, which is Menarche and menopause. And with this, let me hand it over to Haroula to start the webinar.
Thank you, Kartik. It's lovely to be here, and thank you for the invitation to speak once again. Just as Kartik mentioned, today we will be discussing menarche and menopause as two very important transitional periods in a woman's life that can really quite affect many aspects of her life. Let's move on to the second slide, Beth. So there are conditions, of course, that affect all of us, but there are some specific to women, and these two are just but a couple of them. And I want to mention from the very beginning that hormonal issues are quite challenging for women to deal with and often challenging to treat. And having said that, if there are complex conditions that need treatment and are not easily addressed, we really would like to support the fact that homeopathy is a beautiful system of medicine that can help in this regard. And if a woman is having great difficulty and she has tried using different remedies and nothing is working, she should absolutely see a qualified practitioner so that she can get the care she so deserves. Now, menarche comes from the Greek meaning the beginning of the month. So minas means month and archi means beginning. This is the first menstrual cycle of a woman, and it is the pivotal time in a woman's life where she goes from adolescence into womanhood. This is where fertility becomes possible. This is the declaration of fertility, and this is the ability to reproduce. Now, menarche is a complex system of reactions. It is the maturation of the hypothalamic pituitary ovarian axis, which is involved in many hormonal reactions. It is also a time, menarche is a time where the thyroid and adrenal androgens play a major role in a woman's first period. Of course, all of this depends on normal reproductive biology. And let me preface the rest of the conversation by saying that there are many conditions and many variants that can affect menarche and subsequent menses. And we want to be sensitive to those, but in this discussion, we will be focusing on the standard or normal or the way we think of menarche and menses and menopause moving forward, because this could be a very complex and broad discussion. Now, menarche can start at different ages for young women, but typically the age is around 12 and a half to 13, give or take a few months. It is affected by biology, of course, genetics, nutrition, environmental factors like stress. Often chronic diseases can play an effective role in delaying menarche. And if this period does not begin by the age of 16, usually it is recommended that a girl get a physical examination to make sure that everything is functional and fully operational. Now, we also have to examine the physiological and anatomical process of puberty. There is a very quick growth process that takes place, and menarche usually begins when a girl reaches at least 17% body fat. And to maintain a menses, the body fat retention must be even higher at approximately 22%. Now, the first menses of a woman is quite a special time in many, many cultures. The initial flow of blood may be quick and profuse, or it can last quite some time. It can be accompanied by many different symptoms, including cramping. It doesn't always begin with ovulation. Sometimes ovulation even begins before a girl's first menses. So this is a very challenging hormonal time for many women because it's never quite consistent across the board. Some women who begin their menses don't even ovulate for quite a few months and sometimes years into their menses. Menses, of course, menstruation is the monthly shedding of the functional uterine endometrial lining when ovulation is not followed by fertilization. It lasts between 3 and 7 days, and it occurs monthly. Typically, or standard, is usually every 28, but most women are give or take about a week. Now, this that takes place during menstruation. I'm not going to get into it because it talks about the gonadotropin releasing hormones, follicle stimulating hormone, luteinizing hormone. If you'd like to read about it, please do. It's in the slides and we can share these slides with you. This is just to discuss the physiology of the hypothalamus releasing a hormone that then stimulates the follicle stimulating hormone and luteinizing hormone from the pituitary gland, which subsequently releases estrogen from the ovaries, and how this physiological process works with the end result being menstruation if the egg is not fertilized. And here's a quick depiction. Let's move on. Now, hormonal changes, as we had previously mentioned, can be challenging because the rise and fall of hormones over this menstrual period can lead to and manifest different conditions in women that are not necessarily wanted, including acne and dysmenorrhea, breast pain, mood swings, headaches, lots of premenstrual symptoms. And this is where homeopathy comes in beautifully and really helps in such conditions. With acne, acne is very common in women who are ovulating. It usually begins about a week's time before the blood flow, and the first half of the cycle is estrogen heavy. The estrogen falls, progesterone increases. There is also an increase in sebum production, and what that means is that the skin produces sebum, which swells the skin and compresses the pores. And if the pores are made smaller due to this compression, the sebum accumulates underneath the skin and bacteria feed off of the sebum. Now, what's the big deal, you say? Well, if bacteria are feeding off of excessive sebum, the skin becomes inflamed, it becomes red, and it creates acne, which is not necessarily something that women want. Forward, please. Dysmenorrhea, painful periods, of course, come with the menstrual cycle. This is due to the fact that uterine contractions fluctuate as a result of hormone spikes and drops. It's more common in women who have not given birth, and after giving birth, many times women feel better and they don't have as many cramping feelings during their period. They're felt in the lower abdomen, of course, and the pain can be annoying, it can be aching and throbbing and cramping, it can go to other places of your body, like your back, and radiate down the legs. Now, when the uterine contracts in order for the blood to flow, sometimes the contractions are quite vigorous because as we mentioned, due to the changing and variable hormone levels, sometimes the blood vessels become compressed. Very briefly, the blood flow to the uterus is cut off, and that's what causes the pain. Mastalgia is also breast pain, and this is something that women feel quite a bit of during their menarche. The hormone fluctuations, again, cause breast tenderness and swelling. They could potentially cause the lobes and the glands to enlarge, which is very painful. And this is all, of course, in preparation for pregnancy. And so the body gets prepared for pregnancy. If there is a period, it means that the egg was not fertilized and embedded into the endometrium lining, which is why then these symptoms go away once, typically go away once the flow of blood begins. Mood swings are a very common symptom that women face during their menstrual cycle. There's sometimes a great deal of irritability or PMS, depression, anxiety. It usually begins about 2 weeks before the onset of menstruation. And stress, of course, and other life circumstances can definitely make PMS worse. Now, female hormones do interact with brain chemicals in a way that can affect a woman's mood. And the reduced levels of estrogen are connected to a drop in serotonin levels, which will affect the mood of a woman before her period begins. Now, many women experience premenstrual syndrome, but some of them experience it quite extensively. Instead of just the regular irritation that we often think about or bursts of anger, some women go into quite a deep depression, and there is rage instead of simple anger, or a lot of panic instead of worry. These sort of more difficult and serious symptoms are categorized under a condition called premenstrual dysphoric disorder. And many women experience this too, about 3 to 8% of women. And this is something that we need to keep in mind, because if the hormones are fluctuating to such a degree that they're putting women in such a deep state, we really need to recognize ways of helping. Now, menopause, on the other end of the spectrum, when we're talking about the initiation of a woman's cycle versus the end, this is the end of a woman's cycle. It's a natural part of life, and it marks the complete ending of a menstrual cycle. Now, menopause is when a woman is without menses for at least 12 months. And it can be a long transition. It doesn't just happen that a woman's cycle stops. It can last, between 1 and 10 years or even more. Now, this is also a hormonal transition. It is marked by the reduction in the production of estrogen and progesterone by the ovaries. And what this transition means is that ovulation ceases, as does menstruation. Now, to get into menopause, the estrogen and progesterone levels decrease over time. And women usually see signs and symptoms of menopause, like irregular periods. It means that the cycle is slowing down, and this typically takes place in a woman's life when she's in her mid-40s, sometimes earlier and sometimes a little bit later. Now, estrogen, as we mentioned, stimulates serotonin and beta endorphins, and when the estrogen falls, of course, this does put women into a bit of a negative state. And we'll talk about that very briefly. As menarche is often celebrated in women in many different cultures, so is menopause. It's viewed as a transformative and elevating experience, bringing with it a sense of freedom and respect within the community. So this is a time for celebration. Unfortunately, many women have symptoms that prevent them from celebrating in such ways. So the same hormones that control a woman's menstrual cycle also influence serotonin, which promotes the feeling of well-being and happiness. As the hormone level drops, serotonin also falls, which contributes to increased irritability, anxiety, and sadness. Unfortunately, women are twice as likely to develop such symptoms than men, and this is why we're discussing women's conditions here. Memory lapses or concentration weakness is something that women feel during menopause. Now, it's not as a direct result necessarily of the reduction in production of hormones. It is also a factor of age, but it is something very particular that women experience during menopause. It can be linked to sleep issues, as well as vascular symptoms associated with menopause, like hot flashes. I mean, think about it in the way that if a woman is experiencing these changes, her body is changing, and hot flashes are one of the symptoms that menopausal women discuss very often. Now, if they are experiencing hot flashes, it means they're sweating, there are night sweats. It means that they are not able to sleep because of these hot flashes and night sweats. It means that their mood is low because of these fluctuating hormones, and that will lead to difficulty in concentration. The hot flashes that we just discussed are an increase in the body's temperature, and as a result, sweating occurs to cool the body off. There could be an increase in heart rate, a sensation of heat in the chest and the face are felt, followed by flushing and maybe even chills. 75% of women experience hot flashes, and so it would be really important to discuss that during this time, as well as discuss remedies that might help in this transition. The hot flashes often interfere with a woman's quality of life, and they can last what seems like forever and happen often throughout the day. The hot flashes, of course, as mentioned, could lead to night sweats, which makes good sleep difficult. It could lead to loss of productivity because the sleep is interrupted. It could result in feeling drenched and having to get up to change at night. And this is all quite disruptive for women in this transition period. Okay, we already talked about sleep problems. Let's move on with that. Thinning of hair. Now, this is a very interesting condition that many of us experience during menopause. The reason for the thinning of hair is because the when there is a drop in the estrogen and the progesterone production by the ovaries, these are the same hormones that help our hair grow and stay on our head. And so if the production is lessened, of course, the hair follicles are affected, hair can become thinner or finer, and the retention of hair is simply not what it used to be when those hormone levels are elevated. In fact, hair can grow on different parts, which is even less attractive than what we want. Osteoporosis, for the very same reasons, osteoporosis. Now, what we're going to get out of this talk is how important hormonal balance is, really, when we're not in balance and with these hormone fluctuations. I mean, it's not just one process that is affected or one system that is affected in our bodies. Osteoporosis is yet another condition which really heavily relies on the estrogen progesterone levels being at a certain level. The estrogen is a hormone that contributes to bone strength, and therefore when there's a decline in estrogen, we see a loss of bone mass, which then contributes to bones becoming more brittle and weak, and women are then at risk of fractures and feeling this weakness, and at risk of just falling and breaking something, which can be quite dangerous at an older age. Vaginal dryness is also another symptom that comes with the reduction of estrogen production. Lubrication is something that estrogen plays a major role in, as well as the pH of the vagina and reproductive organs. A lowering of the estrogen or a fall in the estrogen production triggers the tissues to become thinner or more easily irritated, dry, less elastic and flexible, which is very uncomfortable, and women definitely need help with. And what is the issue with weight gain? Many women complain about gaining weight during menopause. It's because metabolism slows down, and there's a hunger hormone called ghrelin that increases during perimenopausal women. So we're eating more, our metabolism is slowing down, and of course we gain weight. It's not necessarily because of menopause itself, but because of all of the surrounding processes that take place. Fat storage increases, especially around the abdomen, which is linked to insulin resistance and other associated conditions like heart disease and diabetes. Let's continue. And headaches, and for the very same reasons, hormonal fluctuations affect women during not only menopause, but women who experience headaches during menopause often are the same women who experience headaches during their menstrual cycle. These drops, it's okay, these drops in estrogen and progesterone do trigger headaches. They cause the blood vessels to dilate, and tension headaches are created. The blood vessels are constantly expanding and contracting. Sorry, one second. And these pressure changes are felt in the head, and this is why we experience headaches.
Okay, thank you, Haroula. That was a great summary. And Kartik, thank you to you as well. We always love to be here. I am going to embark on talking to you all about a number of remedies that are useful for this state of hormonal change and fluctuation. Now, in presenting these remedies, what we're really talking about are remedies that have a particular affinity to female reproductive organs, female reproductive systems, and to female hormones. And so as a result, any remedy that has a strong affinity to the female reproductive system is going to be indicated for different reasons at any point in time when those hormonal changes are very much in play and not really quite integrated into normal function. So menarche and menopause being two very obvious examples of that time. The interplay between hormones, mental, emotional, and physical symptoms is such an essential aspect of these shifting times in a woman's life. And homeopathy is so beautifully situated to address these sorts of complex hormonal impacts on the female human organism. And I think we're so lucky to have homeopathy. I think we commented last time when we were talking about women's acute conditions that one of the issues in allopathy, in my opinion, is that certainly in Western medicine, almost all allopaths have been, until really the last decade, male. And so much of allopathic medicine, allopathic research, testing of drugs has been around men and around men's health. And women are different. We have different functions, different hormones, and we need a different kind of treatment. And I think women have felt very underserved and disappointed by what allopathic medicine has had to offer in terms of these complex hormonal scenarios. And again, homeopathy, which tends to be more female-centered and certainly more of a totality approach, is beautifully situated. So the remedies I'm going to be talking about, I'm discussing both in three ways. First and foremost, I'll be discussing them in terms of their applicability to women's health issues in general. Now, some of these remedies, or all of these remedies, really have very broad pictures, and I'm focusing exclusively on issues that pertain to women and women's health. When talking about menopause, it's clear we understand that menopause is a long transitional period, and we know the idea of perimenopause, which is the start of a shift in women's life and the movement to complete menopause. And that in and by itself, that time from perimenopause to complete menopause can last years and years and years for women. Likewise, menarche can also last for many years. We're accustomed to thinking that, oh, this young woman has got her first period, therefore she is now fully hormonal, a full woman, and so on and so forth. But actually, just like the diminution of hormones at the end of life, the establishment of normal and functional hormonal levels takes years and years for a young woman. So when I refer to menarche, I'm not referring to that one moment in time when the first menstrual cycle appears, but I'm talking about those first years of menstruation that in which hormonal normalcy and regularity becomes established. And it's during that time that we see women, young women in particular, suffering with a lot of discomfort and a lot of issues as their body and their entire homeostasis gets sort of established in this new hormonal reality. So I'm going to talk to you about three remedies that are very common. They're well-known remedies, and they're useful. They're the very first remedies we think of when we think of female hormonal issues. And then I'm going to talk to you about some remedies that you may not be quite as familiar with. So the first remedy is sepia, and we all know sepia. We're all quite familiar with sepia, the cuttlefish. It's from the mollusk family, and sepia is well known to be a remedy that displays indifference to loved ones with this desire to sort of escape to a place where she has no responsibility, where she's unconnected with family, where she's very much on her own. And I wanted to read to you, and you'll see on your screen, a quotation from Philip Bailey, who is a wonderful homeopath who has spent a lot of time trying to understand the psychological dimensions of remedies. Bailey says that sepia is often said to suffer from a loss of her femininity, as indicated by her aversion to men, her indifference to her children, and her aggressiveness. All of these can occur, or do occur, but they occur not so much because sepia has lost her femininity, but rather because she has surrendered her independence. Sepia is naturally very feminine, but her femininity is of a special kind, being intuitive and sensitive to life and the body. She represents one pole of womanhood, whereas pulsatilla, which we'll be discussing next, represents the other, more nurturing, passive pole. It is when sepia is pressured by her upbringing and her society to deny her own form of femininity that she becomes aggressive and ultimately may come to hate men. So we discussed already the indifference to loved ones with this desire to escape to a place with no responsibility. There's that feeling of being hard done by duty, by occupation, by school, by family, the feeling that she has to accept situations against her will. The sepia woman is notably, the sepia woman is notably irritable, easily offended. She has mood swings. There's stasis on all levels, physical, mental, and emotional. She presents as nagging, as complaining, as dissatisfied. She tends not to have attachment, no commitment. She's uncommunicative, but weeping when telling of her situation or her symptoms. There's a strong amelioration and desire for dancing in sepia. Did that get cut out? I just think you can't see that. I'm not sure why. There's strong bearing down pains in the pelvic area, leading to constipation, lots of chilliness. And sepia is famously never been well since the over-the-counter birth control pill. And a lot of young women are put on the over-the-counter birth control pill to address the symptoms of this establishment of a shift and change in their hormonal base. And actually, women who need sepia do really poorly on the birth control pill. So in addition to talking generally about these remedies, I'll also mention specific indications for menopause and specific indications in the earlier stages of reproductive maturity or menarche. So the specific indications of menopause includes easy flushing, hot flushes with palpitations, dryness of the vagina, and a strong aversion to sex. Dryness of the vagina is pretty much a common symptom throughout menopause, but the aversion to sex is very particular to menopause, as is the to sepia, as is the bleeding after sex. There's a lot of metorrhagia, which is non-menstrual bleeding at the time of menopause, and then sudden flushes of heat with weakness and sweat. The specific indications of sepia in puberty and menarche or young women or that early stage of hormonal maturation are easy blushing, The hot flushes that we see in menopausal women and the easy blushing in young women are the same kind of a vascular symptoms, just at different ends of the spectrum. Young women suffer with scanty, late, irregular menses with sharp clutching pains. They tend to have headaches with their menses. There's a faintness, a chilliness, and a shuddering with the menses. As well as a feeling of weakness in the pelvic organs, in this fear that almost like their sexual organs are going to drop out of them, and they tend to cross their legs for relief from those from that feeling. Pulsatilla is another remedy that has a strong affinity to the female genitourinary system, also mucous membranes, the veins, the GI tract. Pulsatilla is known, its familiar name is the windflower or the meadow anemone, and it's of the Ranunculaceae family. Pulsatilla is a remedy that in all instances has a strong aggravation from change. And so you can understand that at times of hormonal change, pulsatilla could be well indicated. Generally, pulsatilla is creative, it's sexual, it has a lot of energy, sexual energy with its hormonal pathologies. Pulsatilla tends to have a weak ego. They're immature, they're easily influenced, they're hurt, they're swayed easily, and every little offense throws them off balance. They feel oversensitive, they're dependent, they have a lot of difficulty separating, thus the aversion or the aggravation to change, because that's like a separation from the known, a separation from the normal that they have experienced previously. Likewise, while change is different, pulsatilla suffers with changeable symptoms. There's a lot of anxiety with fear of losing control. They're affectionate and mild, tearful and emotional. They have strong forsaken feelings. They're yielding with this desire to please, worse alone, ameliorated by consolation, chilly with an intolerance to any form of heat, aggravated by fats, aggravated by rich foods, and ameliorated by gentle motion and open air. The specific symptoms of that indicate pulsatilla and menopause are melancholy, the changeable moods, alternating heat and chills, aggravation in stuffy rooms, and an improvement in open air. But you would also expect to see the symptoms mentioned above, the tearfulness, that feeling of being forsaken, the feeling of being yielding. It's a very different type of presentation than in some of the other remedies we will be discussing. In puberty or with young women, we have a very different picture. So pulsatilla is known to be never been well since puberty. So women who go through that hormonal change and never quite pick up their momentum again to move forward often need pulsatilla. So puberty is the first stage of true psychological emancipation from the family, which pulsatilla does not seek. She trusts her omniscient parents and does not fight against them to assert her independence, which is something you'd expect to see in adolescence of other remedy pictures. In her resistance to maturation, she acquires a host of unexplained little aches and pains, last week in the knee, yesterday in the head, today in the chest, tomorrow in the abdomen. In this way, she remains reliant on her parents' support, at times even developing into something of a malingerer. Many of her later legitimate complaints, such as chronic headaches, bladder infections, allergies, or painful menses, can be traced to a pre-adolescent or early adolescent period of inception or the start. This is a quotation by Catherine Coulter, who does beautiful work with children and children's psychology and homeopathy. And you can see that this presents a certain type of adolescent young woman, the adolescent young woman who's not going to be a rebel, who's not going to question her family, who's not going to push back, who does not want to grow up. And we'll look at some other adolescent types as we move forward. So we can understand that virtually any symptoms during this period in a young woman who has this mindset, this sort of perspective on life, pulsatilla would be strongly indicated. On more physical levels, menses are delayed at puberty. So these are young women who start their periods quite late. The menses are late in terms of starting, and they're late in terms of the length of cycle. They're scanty, they're clotted, they're changeable. The flow stops and starts. They have painful periods with chilliness, paleness, and yawning. They have metarrhagia, again, non-hormonal bleeding, acrid, milky, thick leukorrhea, which is discharge, and teen acne. And the third of the very common remedies that we're going to be discussing today is the bushmaster snake, or lachesis, or lachesis, depending on where you've been trained. So lachesis is the serpent of the lord of womankind and fertility, regarded in many traditional cultures to be responsible for menstruation. The Guarani tribe of southern Brazil expresses the onset of Menarche as in an expression that means the serpent has bitten her. So there's this very strong connection between lachesis and these changes of female hormonal state, both at the beginning, menarche, and at the end in menopause. In some religions, the snake is revered. In others, it is greatly feared. This duality can be seen in the remedy picture itself. On the one hand, women needing lachesis, or what we call lachesis women, can be immoderate. They can be wild, living in an intense and passionate emotional whirlwind. But on the other side of this polarity, they can have great mental discipline and keep their animals' side entirely in check. Lachesis has an affinity with the female organs, with nerves, heart, circulation, blood, ovaries, and throat. It's especially a left-sided remedy. Lachesis is intense, it's passionate. Lachesis women tend to be sharp-tongued, bright, witty, talkative, with great command of the language. They have an overactive minds. They're strong-minded. They're disputative. They're constantly complaining. And we can take any one of these symptoms. I just want to pause here for a moment. We can take a symptoms like this idea of being disputative and constantly complaining. And we can see how this would so commonly and likely be a kind of symptom that we would expect to see in adolescents at the time of menarche, but also very typical of a certain type of quote unquote old crone type menopausal woman. So we see these pictures. You can, if you pick apart these symptoms that I've provided you with, you can almost imagine what this would look like in menarche and what this might look like in menopause. Lachesis is jealous. They're seeking that which will improve their advantage. And that's because they are competitive and suspicious and want to have the upper hand. They're egocentric in this way. They're unable to see other people's perspectives. They're unable to share others' emotions. They have a very strong sex drive and a vivid imagination. They're ameliorated by any discharge and aggravated by the cessation of discharge. So if we look at the amelioration in a young woman of her menstrual complaints or premenstrual complaints, physical or mental, emotional, at the very start of the bleed. So as soon as the flow begins, the discharge begins, they start to feel better. Likewise, the cessation of discharge. Menopause is a cessation of discharge in the greatest sense of the word. And so these are women, this is a remedy that's so strongly indicated in menopause because the stop of their monthly discharge is very, very difficult for them. I also want to add that talking is a kind of discharge. It's a kind of emotional discharge. And you can understand that why Lachesis women are famously loquacious. They talk a lot. Lachesis is aggravated during and after sleep. They cannot tolerate tight clothing. And there's a lot of purplish and bluish sort of discolorations from circulatory disturbances. So specific indications in menopause for Lachesis include copious menses. And remember that during much of the phase of menopause, and we're defining that as the start of this perimenopause, the start of a slow process of shifting of hormones right through to 1 year without menses. That's when we're in full-blown end of the menopausal phase, that women are still menstruating. Often they get flooding periods, very, very heavy, copious periods, and then they don't get a period the next month, or they don't get a period for the next 3 months, or the next period is completely different. So this copious menses, often with alternate periods not occurring, or the alternate periods being very feeble or lumpy or scanty, is typical of Lachesis. Menorrhagia with chills at night, flushes of heat by day with intense heat in a flushed face, hot flashes with a sense of suffocation, palpitations, congestion in the face, malaise, thirst with a dry mouth, palpitations, hemorrhages, headaches, fainting spells are all in menopause, all call for Lachesis. Prolapsed uterus in menopause calls for Lachesis. And difficulty sleeping with dreams of dead people, of coffins, of snakes. Lachesis tends to be best indicated for slender, think of the shape of a snake, slender, nervous women who are quick to anger. In menarche, in puberty for young women, the indications you'd expect to see, again, that copious menses, often with alternate periods not occurring. So it's the same picture, but for very different reasons. The less the flow, the greater the pain. There's severe PMS before the discharge and the start of the blood flow. And there's also vicarious menses, which means bleeding elsewhere, often as a nosebleed or epistaxis. So I am realizing that, seeing as I've gone through 3 of my 8 remedies, we're going to find ourselves without, I'm not going to be able to get through all of our remedies. I have prepared notes for you here on Platina, on Murex, on Lilium tigrinum, on, on Senecio aureus, and on Angelica sinensis. I wanted to give you an array of remedies, better and less well known, for you to work with. So what I think I will do is go through Platina with you. And at that point, I'm going to leave the notes, and you're welcome to read through them. And please, any questions you might have about these remedies, please email OCHM, and I will be sure to get back to you about these. And I hope that this provides you with a really good sort of toolbox of things to turn to should you be presented with cases either in your own practice or in your personal lives of women suffering with issues around menarche, or the start of their hormonal change and the end of that hormonal period of fertility. So let's look at platina together. Platina is the metal platinum. It's used especially in jewelry and in laboratories, scientific laboratories. It has a strong affinity for the female organs and nerves. Women, general symptoms relating to women's health that have to do with platina are that they're very idealistic and they have romantic fantasies about marriage and life. And you can understand a young woman having very romantic ideas about what her married life is going to be like, what her romantic life is going to be like. It's again, one of these symptoms you can so readily picture in a young woman. And likewise, you can picture in an older woman, because there's this strong element from disappointment along with this idealistic idea of about marriage and life. And these are women who have already had long lives and presumably marriages and may have a lot of disappointment about what those have been. They did not live up to her romantic fantasies of her adolescence. Platina has a great sensitivity to rejection. They feel easily slighted, easily ignored, abandoned, deserted. They dwell on past disagreeable circumstances. Yet at the same time, they have a kind of disdain or contempt for others, a bit of a sense of superiority, of being better than others. Remember, we're kind of in a heavy metal area here at this point. They have dullness and indifference in company, big time mood swings. And mood swings is something, again, you expect to see in young women and you're not surprised to see in older women. They tend to be taciturn and abrupt. They're bored and fed up. Again, easily imaginable in both young women and older women. And they have a great desire for sweets. They have a high sex drive. They're easily aroused. And they have a lot of pelvic congestion, which leads to genital hypersensitivity. And they cannot tolerate even the least contact with the vulva. And this is particularly marked in young women. Specific indications for platina and menopause is difficulty falling asleep, for thinking about past events in her life, frequent waking with anxious, sad, and distressing thoughts. I hardly know of a woman over the age of 60 who does not complain about having difficulty sleeping, difficulty falling asleep, difficulty staying asleep. And this is a very particular picture of this difficulty with sleep. There's an intensive depression for women in menopause who need platina. They also have pains in the cervical region of the spine with stiffness and vertigo. And in fact, there's pains throughout the back with a lot of stiffness. Their feet hurt. They feel stiff in the morning. The skin breaks down, it gets wrinkled prematurely and dehydrated, and they have a lot of itching on the face, the head, and the body. They tend to have brown spots, what we often call liver spots, on the back of their hands, and their nails are striated and grooved. In young women, we have a slightly different picture. Young women feel that the environment and the family circle are deteriorating. They're critical. They criticize. They feel that they're clear about themselves, who they are, their circle, and their family circle begins to appear illogical or unfamiliar. They feel different compared to other people, especially as regards to the family. And this is an absolute polar opposite of the picture that we described in Pulsatilla, where young women are reluctant to leave the family. They're reluctant to grow up. Whereas in this says lachesis, and it should say it should say platina on the top. So excuse me for the confusion. Women in platina are the young women are the exact opposite. They're distancing themselves from the family. They're pushing the family away. They're defining their separation between themselves and their family. These are young women whose circle and whose circle of friends become extremely important, and they oppose their family in sort of almost liaise with their friends as the people who truly understand them. Women, Platini young women, have early menses. They're very profuse. They have painful menses with shrieks and jerks. They have menses with chilliness. And again, there's that extreme sensitivity to the genital area that we discussed previously. So I am going to leave our discussion here. Please, I have lots of notes for you prepared for some other remedies you're perhaps less familiar with: Murex, Liltig, Senecio aureus, and Angelica sinensis. And I do hope that you can get a lot out of those. And yes, please, as I say, let me know if there's anything that I can answer for you to clarify those. And so I think we should wrap up, and Haroula and I are available to take any questions from you at this point in time. And I'm assuming Kartik will monitor the questions. Haroula? Kartik, is anybody there? Okay. I'm going to see if I can see how to shrink this up and answer questions. Okay. Please, madam, details about breast pain. So I do not have, hi there. I was not, the breast pain, I did not cover breast pain a lot, really at all, in the remedies that we've discussed already. Conium is a really good remedy to consider for breast pain, particularly when there's induration or hardness of the breasts. I would never look at a single physical pain, like a symptom like breast pain, outside of the larger picture of what's going on for that patient. So in answering a question like that, I'd really like to have some more details about what the patient's issues are, what their mental emotional state is, what their physical generals are like, because breast pain is just so common of a symptom in any of these times of hormonal change that without putting it in a larger context, it's really quite difficult to answer that more specifically. But conium is always a good remedy to look at for breast pain issues. Are there any other questions?
It's always a good question in terms of potency selection. And I think the potency selection really quite depends on the state of the patient and their vitality. A lower vitality would indicate a lower potency and perhaps a water dose more frequently. But if the patient is quite vigorous and able to handle a higher potency, surely that can be implemented.
I also look at this and try to understand how comprehensively the remedy covers this picture. If it's simply a functional disorder, so for instance, if the only complaint really is hot flashes and you're just have really very little idea of what to do, I would start with a remedy such as lachesis and go low in potency, you know, like a lachesis 6, and do that daily for a while and see how it works. What you really don't want is for a woman who, for instance, I'll take the example again of hot flashes, is waking 6, 7, 8 times a night, drenched in sweat. You really don't want to aggravate that symptom in any way whatsoever. So I would always start very low potency. I tend to be a low potency prescriber, and then go up as indicated. And if that potency is working well, but not holding, you can go up in potency. But as a rule, functional disturbances go lower in potency, and more mental, emotional disturbances go higher in potency.
There's another from Dr. Akhilesh Khan. Can you explain the miasmatic revelation in each phenomena in case of menopause and menarche?
Well, are you asking how? I mean, I guess that we could, do broad miasmatic sorts of depictions of this, but neither menarche nor menopause are pathological states, and so in and by themselves they really have no connection to a miasm. Certainly a woman who has severe, dramatic, destructive, extreme symptoms in either of these changes, I would consider that probably syphilitic. A woman who has a lot of shame and distress and almost this inability to wants to hide the reality of the changes of her physical state. I guess that would be a very kind of sketchy, psychotic picture. And likewise, a woman who has a lot of the clinging pulsatilla woman, the woman who doesn't want to change, who can't seek, who's frightened and disoriented and confused and saddened by changes, would be a more soric picture. And while I know that's very general, I think I hope that's a helpful answer.
Yeah. There is another question from Dr. Nutan Sharma. When you have ovarian pains, how would you differentiate between sepia and lachesis?
Because you don't look at just one symptom is the answer. You look at the ovarian pains, which again are common. You want to look at the sensation of them. But in sepia and lachesis have such vastly different pictures that you don't simply look at the ovarian pains. You look at the woman's attitude toward her ovarian pains. You look at her reaction to her ovarian pains. You look at her mental and emotional state around it. You look at when the pains occur. Are they happening before, during, after menses? Are they happening where in relation to her menopausal journey are they happening? So any one of these physical pains, because there's so much common symptomology in all of these remedies and in these states, what you're really seeking in understanding what remedy is, you're seeking to understand that which is an individual presentation of the state of menarche, the state of menopause in that woman. And so it's going to be more than breast pain. It's going to be more than ovarian pain. It's going to have to include a larger picture of a presentation of who they are.
Acute syphilitic affections of ovaries. What does that say? I'm asking acute syphilitic affections of ovaries. If you have such a condition, how would you choose between lachesis and sepia?
I think the answer is the same. I think it depends. And
we need more information.
Right.
Mhm.
Okay. Yeah.
If it's a really syphilitic picture, you know, an acute syphilitic depiction of ovarian disease, I mean, you would need a lot more information, and that doesn't fall within the sort of normal symptom picture of menarche or menopause. That is a seriously pathological picture for which we really need a lot of information. Absolutely. But of course, starting by looking at more syphilitic remedies would be a good idea if you're sure you've got a really syphilitic picture. And certainly, you know, some of the remedies, you know, lachesis is going to be more syphilitic, or a more dramatic picture, certainly, than say pulsatilla or sepia.
There's one more, which is Senecio. Did you?
Senecio aureus.
Senecio aureus. Yeah.
I've provided notes for that. I was only able to get through 4 of my 8 remedies,
All
but
right. Okay.
there are notes on Murex, on Lilium tigrinum, on Senecio aureus, and on I forgot what my last one was, on oh, right, on Angelica sinensis. I have notes provided, and as I told people who are listening, that if there's any questions about anything in those notes, to please contact us at OCHM, and I'm more than happy to help them out. But there's a lot of information packed in there, and we needed more than an hour.
That's true. You're talking about what, almost 40 years
Mhm.
of the life cycle.
Yes.
Oh yeah, so you
Yeah.
definitely need more than 1 hour to cover that.
Mm-hmm.
Yeah. Is there anything else you'd like to ask Beth or Harula? Where do we find the notes?
I can send them to people if they email me. I've just
Yes, if you
put
can
up my
email
email.
them, they'll be happy to send the notes over to you. Could probably just get the answer. Probably just put it out on the chat again. Yeah, info@ochm.ca.
Mhm.
Yeah. So just a little bit about OCHM. How long have you been running this college?
It's been more than 20 years,
Oh,
and
really? Okay.
yeah, and
Uh-huh.
we love this field of expertise because it's so vibrant, and we're able to create incredible homeopaths. We've been graduating incredible homeopaths for 20 years now, and um, the best part I think about our program is that when people come to us, they think, oh, I'm just going to get a standard homeopathic education, and that's not the case.
Mhm.
Every year we make our curriculum better and better, and we are introducing special talks and special lectures, and clinic is really the core of the program, in that, you know, it's where the students consolidate all of their academic learnings into a very rich experience in the clinic, where they get to treat patients live under the very careful supervision of experienced homeopaths. So it's a very interesting curriculum. It is incredibly rich, and we teach people how to think and come to medicines to help people, rather than just give them 100 remedies to memorize and protocols. Um, it is a very engaging curriculum, and we cover both the health and medical sciences as well as classical homeopathy.
Yeah, so you have a short course as well, or do you have just a,
We do. We have a
yeah,
course that is a foundations course in homeopathic medicine.
all right.
It is a course based on philosophy as well as acute prescribing and repertory. And this course is really quite in depth. It's actually equivalent to many courses that people take around the world as full time. So we're really quite proud of the curriculum.
That's nice. That's nice. I didn't I didn't know you were there for so long. That's
Yes.
almost 20 years. That's a good time.
Yeah.
And how many homeopaths have you actually trained in
Oh,
all 20
hundreds.
years?
Certainly not
Uh,
thousands. I mean, we don't, the demand in Canada is not as high as elsewhere, but definitely hundreds of homeopaths. I would say about
uh,
500.
wow, okay. That's a good number.
Yeah.
Yeah. So we have more requests for you to do more webinars.
Thank
So
you.
yeah, we
You're
just had
keeping
Dr.
us on our
Akhilesh.
toes.
Yeah, we had Dr. Akhilesh wanting more. So
Maybe we could do
yeah,
one more women's condition. Maybe we can focus on fertility or something, Beth. What do you
yeah.
think?
I think fertility is a
Let's
good.
talk about it.
Yeah,
Let's talk about it.
yeah.
I think
Uh,
fertility is so strongly constitutional that I think it's a little challenging to do in a talk like this, but we can certainly discuss it. So,
True, true.
yeah, but
Yeah,
we could do it. We could do it for sure. So
that's nice. So we have our next subject lined up.
don't commit us to it yet. Give
Uh,
us a week.
sure, sure,
Okay.
no problem. Yeah. So
Kartik, we're so grateful for the opportunity, and we really, really enjoy talking to your people, and we get such interesting questions, and really many, many thanks to you.
I think we should say thanks to you for sharing all this knowledge freely and helping people make themselves better because this is all about life, sharing, helping. And I hope everybody who was here has something which they can take back and apply when they meet their next case. So with this, I'd like to say thank you to Beth and Harula and all of you who are with us, and we hope to see you next week at another webinar, which we will email you. If you have not registered, you can do so on our website, and we'll send you emails with the links for the next webinar.
Okay.
So till then, bye-bye. Bye,
Thanks so much. Bye
everybody.
bye, everyone.
Bye,
Thank
Beth.
you
Bye bye.
Bye,
again.
Harola.
We'll be in touch.
Yeah, sure we will. Bye-bye.